Hey everybody, welcome back. This is Nurse Eunice, and tonight we're going to be covering 35 practice CNA questions. We're going to help you pass your nursing assistant examination on your first attempt. And so, as we do in each of our videos, we're going to give you a few seconds to receive your notifications. And hello everybody. Yes, I've missed you, and I hope that everyone is having a wonderful week. If you don't know, this is the weekend, you all. We're going to hit 1 million subscribers and the crowd goes wild. Okay, or at least Nurse Eunice does. But anyway, I want to thank you all so much. This has been a journey from start to a new start. Having 1 million subscribers just means that we're putting out quality content. We're helping people pass their examinations, and that you are liking, subscribing, and sharing our videos with others. So we couldn't have reached this goal without you. So we just want to say thank you and that we love you. And from my staff, from my team, and from myself, thank you so much. You are our family, and let's get ready to pass this exam. So, as you prepare for your practice test tonight, I want you to find a quiet space to focus. If you don't have anything to write with and write on, go ahead and do that. Get it right now. And then we're going to read each question carefully and then trust your instincts. You already have the heart of a healthcare provider, the heart for patient care, and you have that compassion and attitude. That's what matters. Your bedside mannerisms are great. Now we just got to make sure that you understand the care concept. So here we go, team. All right, question 1. The charge nurse asked the nurse aide to place a client in the Fowler's position after the client eats breakfast. How should the nurse aide position the client? A, lying with the head of the bed elevated at 45 to 60 degree angle. B, lying with the head of the bed elevated at a 10 to 30 degree angle. C, lying flat on her side. Or D, lying flat on her abdomen. And we'll give you a few seconds to put your answers in the chat. And I see everyone saying hello. Hey, y'all, I missed you all. I know it's been a while. It's been a very busy summer, but good things. And next month, hopefully we can slow down more and we can actually shoot more content. So hello, I love you all. And I'm so proud to see that you all are passing your examinations. All right, so question 1. Yes, the answer is A. And so it's going to be 45 to 60 degrees after they've eaten. And so the Fowler's position is commonly used for comfort and for improving digestion after meals. So remember, during mealtime, you have them in high Fowler's, and then after mealtime, you can relax them back somewhat. That would be the traditional Fowler's position. That allows the food time to digest, and it decreases the chances of them having gastric reflux. Question 2. How many stages of death were identified by Dr. Kubler-Ross? So yeah, we talked about the stages of death, grief. How many stages are there? Is it A4, B5, 6, 8, or D2? Let's see if you all remember. All right. And a patient or a resident may not get through every stage, but if they do, the answer is B. There are 5 stages. So let's talk about the stages of grief or death. And this could be experienced if a person maybe is divorced. It doesn't necessarily have to deal with death process as far as like cardiac arrest is concerned. But whenever someone has a loss, first, it's going to be denial, not believing the loss or diagnosis is real. Let me get a second opinion. Anger, feeling upset or mad about the situation. Well, Johnny does twice as much as, worse than I do, and he doesn't have cancer. 3 is bargaining, trying to make deals to a higher power often to change the situation. And then our CNAs, you're going to notice it. You're going to notice these stages. Then the patient's depressed. They're trying to stay in the room all the time. They're eating very little. That's where you shine because they feel very sad and hopeless, but hopefully you can help. You can be there. You can comfort them. And then finally, the fifth stage would be acceptance. And so with acceptance, that's when usually hospice would be consulted. So that's when they're coming to terms with the reality of their loss or situation. And so as a CNA, understanding these stages can help you provide better emotional support to residents and their families during difficult times. And again, it's not linear. It's not like a patient's going to go through every step in the same exact order. They could fluctuate back and forth, but not only would the resident or the patient be going through these stages, the family members will too. So you be alert. If it's something you don't understand, just communicate with your nurse. Question 3, a cane should be used on, is it A, the weak side one day and the strong side the next day? I mean, that's balance, right? B, the affected side. C, either side, depending on how the client feels. Or D, the unaffected side. All right, giving you a few seconds, revealing the response in 3, 2, and yes, it's D, the unaffected side. So the stronger side should be holding the cane. So a cane is used on a stronger, unaffected side to provide support and balance. So when you look at this image, this particular is representing someone who has left-sided weakness. And so looks like maybe they had a stroke. And so the affected arm can't hold the cane. So that's why they're holding a cane in the unaffected arm or the unaffected side. So I hope that makes sense. Question 4. All of the following factors contribute to the lack of appetite except for which one? Would it be A, decreased activity, B, depression, C, increased exercise, or D, decreased saliva? Reread the question the same way you'll do during your state examination. All of the following factors contribute to the lack of appetite except which one? Oh, I see so many correct responses. I'm so proud of you. Revealing the answer in 3, 2, and it is C, increased exercise. So that's the one that does not impact. So increased exercise typically improves appetite. It builds their metabolism. It's going to boost it up, so they're going to be hungry. While the other factors can negatively affect appetite. Question 5. Oh, I know you know this one. Atrophy is it A, contracture, B, orthotic, C, muscle wasting, or D, a fracture? What is atrophy? All right, revealing the answer in 3, 2, and if you put C, you're absolutely correct. It is muscle wasting. Atrophy refers to the wasting away or the reduction of muscle mass due to disuse or disease. Remember, if they don't use it, they lose it. Get them up out of bed. Make sure they participate in physical therapy. Walk them around the unit. Do whatever you can to help build muscles. And then also, if they're not eating protein, they should be drinking it. So if you notice your patient doesn't eat meat, they're not eating beans, let your nurse know so that hopefully we can get a supplement like a protein shake that could be delivered to their room. Question 6. The nurse aide, a member of the healthcare team, can participate in many aspects of the nursing process except for, is it A, collecting data, B, carrying out selected interventions, C, making observations, or D, planning the care? What can the nurse aide not do? Oh, I see we're torn on this one. I'm seeing a few varying answers. So I'll give you 5 seconds to answer this one. Revealing the correct response in 5, 4, 3, 2, and it is D. A CNA does not plan the care. They follow the care plan, but they don't start or plan the care. So care planning is the responsibility of a licensed healthcare professional, such as your registered nurse, while nurse aides assist by providing input. That data would be the blood pressure, the vital signs, collecting the data, and then executing a care plan. So if the patient has an incentive spirometer, their breathing apparatus, and that's part of their care plan, you wouldn't do the initial teaching. But whenever you go into the room, you'd be reminding them to use the incentive spirometer. So things like that. That's what we mean by executing the care plan. Question 7. When using crutches, the client's weight must rest on, is it A, the armpit, B, knees, C, hand rest, or D, shoulders? I'm so excited for you. You're going to learn so much in CNA school. And then don't forget, from CNA to LPN is 1 year. And then LPN to RN Bridge is another year. So you can be a nurse, a RN in 2 to 3 years, and you can stop along the way. So if you don't have the family support or the finances to go to nursing school for 3 or 4 years, you can be an LPN and then do the LPN to RN bridge. I'm an advocate of it. And so if anyone tells you that LPNs don't have jobs, so they don't have money, tell them that Nurse Eunice says otherwise. All right. So question 7, everybody. The answer is yes, it is C, hand rest. I know we think that they most of the weight is on their armpits, but that would hurt. So the weight must rest on their hand rest to avoid damage to the nerves and the blood vessels in the armpits. So we're going to use the hands mostly. Question 8. How often should a client be repositioned if he cannot move himself? Is it A, every 2 hours, B, every 1 hour, C, every 30 minutes, or D, every 15 minutes? All right, Mr. Paul is bedbound. He can't move himself. How often would you help to move him, to reposition him? All right. Yes, you have it. It is A, every 2 hours. More frequently if the patients complain of pain, but outside of that, the general practice, the standard in the United States is every 2 hours. And that's going to help prevent those pressure sores, and it also helps to promote circulation. Question 9. An elderly resident with Alzheimer's disease cannot find her room. I always call it Alzheimer's. I know it's Alzheimer's. I'm sorry. Cannot find her room. How can the nurse aide help the client feel more independent? Is it A, tell her to stay in her room? B, have her roommate secretly watch her? C, write the room number on her hand? Or D, place a familiar object on the client's door? So your resident with Alzheimer's disease, they cannot find their room. They're wandering. They're going into everybody else's room. They're coming to you in the nurse's station saying, hey, I can't find my room. Where should I go? How are you going to help them? That is right, team. Yes, it's D. Don't be writing on your patients. So no, you wouldn't write her room number on her hand. It'll be D. You'll place a familiar object on the client's door. So residents with Alzheimer's disease often struggle with memory and orientation. Placing a familiar object or picture on their door provides a visual cue that can trigger recognition and help them identify their room independently. Some of your facilities, the expensive ones, they actually take a picture of their home, the home that they left from before they went to the facility, and they paint their room door. The room door looks like the door to their house. And that's that muscle memory. It's going to trigger them to go into the right or the correct room. Question 10. The goal of bladder training is it A, gain voluntary control of urination, B, stop using a catheter, C, prevent skin problems caused by incontinence, or D, prevent urinary tract infections from indwelling catheters? The goal of bladder training. So for adults, we don't call it potty training. For adults, it is bladder training. So what is the goal of bladder training? I just gave you a good hint. All right, you're revealing the answer in 3, 2, and Yes, it is A. We want to help them gain voluntary control over their urination so they're not incontinent, so they're not leaking urine. So, bladder training aims to help a client establish a routine and regain control of their bladder function. And so, we'll normally start doing this right before we take the catheter out. Your nurse will start clamping the catheter, releasing the catheter, clamping and releasing so they can get the sense of actually having pressure, urine in their bladder again. Sorry, really loud vehicle going by. And then once the nurse removes the catheter, they have to urinate within 8 hours. And so sometimes they may start seeping urine. So we're going to tell them to do their Kegels, do their squeezes down below in their pelvic area to help build those muscles. But then you as a CNA, you're going to take them to the bathroom more frequently and make sure they have that collection device that's going to collect their urine. You can call it a hat, but I don't like that term. And then that way we're going to know if they're actually voiding, number one. But then number two, if every time you take them to the bathroom every 2 hours, if there's just a little bit that's coming out, but their bed's wet, they're going to need more bladder training. So you help with the bladder training process. Question 11. A resident sometimes chokes while eating. The nursing assistant should A. Instruct his roommate to watch him eat. B. Feed him to prevent problems. C. Use the Heimlich maneuver between bites. Or D. Observe him while he eats. What do you think, team? What do you think? What do you think? What do you think? All right, it's not C, because if he's choking while he's eating, maybe you should stop feeding him. So it's not going to be C where you're doing Heimlich maneuvers between bites. But if a resident chokes while eating, um, they're at risk for aspiration. So you're going to do D. You can observe him while he eats. So sometimes your patients who are on a aspiration precautions, they're still able to eat, but they shouldn't be eating without you being in the room. They need supervision. So, and they may be on a thickened liquid diet. They could have pureed food. So they're capable of feeding themselves. But if they start coughing and they're unable to clear their throat, they could have a obstruction whenever they can no longer cough. That's when you do the Heimlich maneuver. So long story short, if your patient's on aspiration precautions, if you can, whenever possible, you want to be in that room supervising them during meal times, and that ensures quick interventions if choking occurs. And when in doubt, get that nurse in the room, because if they're coughing with every meal, maybe they need to see the speech therapist again and get their diet modified once again. Question 12. If a client complains of a burning, tingling area on their skin, the nurse aide should first: is it A, wash the area with water and mild soap? B, report the complaint to the licensed nurse? C, keep an eye on the area for a few days? Or D, use cornstarch on the area? I don't even know where to buy cornstarch from. So if you say cornstarch, you're pretty old. I think that's for baking. I don't think that's for anybody's skin. So we know the answer is not D. Yes, you all, don't be putting soap on something that's irritated. You go tell your nurse first. It is B, because burning and tingling can indicate a serious condition like reaction, nerve damage, or skin breakdown. Get the nurse first and let the nurse assess it before you start putting soap on something, because that could just be masking the issue and it won't get resolved properly. Question 13. When changing a pillowcase, a nurse aide should not hold the pillow under his chin because this would A, tear the pillowcase, B, drop the pillowcase, C, dampen the pillowcase, or D, spread infection. And I know that you're conscious and mindful and that you're a caring CNA. And so caring CNAs don't let things touch their body, or don't let their bodies touch items or things, because it would be D, it would spread bacteria. So all the stuff you do at home, do not do that in someone's facility. You're going to be transferring bacteria most likely to yourself. And now when you get home, you get in your car, those germs are going to travel and you're going to actually contaminate your home environment too. So remember, cleanliness is next to godliness. Nothing should be touching your uniform. If it happens at the test site, make sure you immediately verbally acknowledge it so that your nurse knows that that was a mistake when you're changing the linens. You didn't mean for your uniform to touch the bed. If you don't see anything, they're usually going to give you a mark off for indirect care, or it could be worse. So just make sure that you try to prevent from touching linens. And if you do, verbalize it. 14. A non-sterile dressing is one that is A, wet, B, dirty, C, clean, or D, new. Non-sterile. And I hope you all are having a wonderful week. The kids in our county, they went back to school this week. So just a busy week. I know that's tricky. So non-sterile does not mean that something's dirty. As far as gauze and different dressings are concerned, non-sterile just simply means it's not sterile. It's C, it's clean. So the gloves that are on the wall in the box, those are non-sterile gloves, but they haven't been used. They're still clean. So a non-sterile dressing is clean, but does not meet the sterility required for surgical wounds. As a CNA, you cannot perform sterile technique. You cannot use sterile gloves. So pretty much every procedure you're going to be doing is going to be external. It is not going to be invasive. And therefore, you're allowed to use the clean, non-sterile gloves that are found in the patient's rooms. 15. When asked to clean a resident's eye, the nurse aide should, is it A, clean it with the cloth used to wash the rest of the resident's body? B, use a clean surface of the cloth each time he wipes? C, clean it from the outer corner to the inner corner, so outer to inner? Or is it D, clean the eye with exudates first? And that would be drainage. Okay, when you see exudate, write that down, new term, that'll be drainage. I know that was a lot to read, so I'll give you about 5 more seconds. And if you chose B, you are right. So when we're cleaning the eye, we go from inner to outer. We're wiping the germs away. We're not wiping the germs into. So it's inner to outer, not outer to inner. But then whenever you're going to clean the opposite eye, you cannot use the same spot on the washcloth. So every time you cleanse the eye, you would have to change spots before you go to the other eye. Because if your resident had conjunctivitis or pink eye in the right eye and you didn't change the cloth or change the position of the cloth, you're just spreading contaminants from one eye to the other. All right, question 16. One nurse aide is assigned vital signs, while another is assigned bathing. This is an example of what type of nursing. Is it A, primary, B, patient-centered, C, secondary, or D, team? And I'll tell you while I'm laughing in a moment. If you don't know, I'm pretty goofy. I love joking and laughing. So I'll tell you the reason why I laughed in a few moments. All right, and I'm going to tell you right now, because there's a song, whoop, there it is, tag team. So whenever I think of one CNA doing one task and another CNA doing another task, that's tag team, tag me in. And so the answer is going to be D. That would be team nursing. That involves multiple caregivers performing tasks collectively to meet a client's needs. And so go team. Question 17. Gloves must be worn when A, providing peri-care, B, while walking a resident, C, while washing a resident's hair, or D, feeding a resident. And I know you all are like, Eunice, I'm wearing gloves for all of those. Don't do that on your test. This was not a multiple choice where you can select multiple responses. You can select one response. And so, out of the responses shown, which one is the most contaminating? That's right. It's going to be A, you all. So I know you want to wear gloves for everything, but based on those choices, you must wear gloves when you're providing pericare. So gloves are required during perineal care because it contains bodily fluids or potential pathogens, and you don't want to get those on your hands. The other, washing hair. Yeah, you could wear gloves when you're washing hair, but it's not a requirement unless your patient had, some type of hair lice or something. In most of your tests, you will not wear gloves while you're feeding a resident, believe it or not. As long as your hands are clean, you can still assist them. And you don't need gloves when you're walking a resident. They're not on contact isolation. The question didn't say any of that, but you must wear gloves when someone is being bathed in their genital area, because you don't want those germs on you. And if you need help with your clinical skills, don't forget that we have CNA training videos. We have a whole playlist on our YouTube channel, or you can go to our website, which is fltraining.com, and then click on the three lines up top for the menu, and it will also take you to the clinical skills. All right, question 18. While the nurse aide was caring for a client for 4 hours, the client asked to be taken to the bathroom every 15 minutes. The nurse aide's best action is to A, leave the client on a padded bedpan. B, place the client in a bed with a waterproof underpad. C, give the client some time to rest. Or D, discuss this with the charge nurse. You cared for a resident for 4 hours, and then 4 times an hour, they were asking you to go to the bathroom. You didn't get any work done. That patient didn't get any rest. So, what do you think the best response is? Yes, you got to let the nurse know they possibly have a UTI. So, frequent urination could indicate a medical issue, and it should be reported to the charge nurse. No one has to urinate every 15 minutes. So, even though she feels it, maybe she's not unable to urinate, maybe she's retaining urine, or maybe she actually has a UTI. But there's a problem, and the nurse needs to be made aware. Question 19. An elderly resident with dementia begins to wander on a secured unit. The nurse aide should, is it A, restrain her to prevent injuries, B, orient her to time and place, C, ask if she needs help and continue to monitor her, or D, report her behavior to the charge nurse? All right, so elderly resident, they're wandering. That's what they do, y'all. If they have dementia, they like to walk around, but at least they're walking around on a secure unit. They can't get out. So, what do you think the right response is? Are you going to tie her down because she wants to walk around? She's not hurting anybody. So, yes, it's going to be C. Hey, Miss Jones, do you need help? And you're just going to watch her as she walks around. So, residents with dementia may wander due to confusion, unmet needs, or restlessness. Hold up, everybody. Let me say something. Jalen, leave. My son has just come in and he's just, making all this noise. The nurse aide should approach the resident calmly, ask if assistance is needed, and observe for any signs of distress or unmet needs. Monitoring the resident helps ensure her safety while addressing potential causes for wandering. Restraining the resident is inappropriate and could cause harm or escalate agitation. Question 20. The Hoyer lift is used for all of the following purposes except A, preventing injuries to healthcare workers, B, supporting ambulatory clients, C, moving clients who are heavy, or D, moving clients who are weak. So the Hoyer lift is used for all of the following except for what? Revealing the correct response in 3, 2, and that's right. If they're ambulatory, they don't need to be lifted. So it'll be B. The Hoyer lift is used for transferring non-ambulatory patients, not those who can walk. And so it's not suitable for those who can get up and move on their own. So it's not suitable for people who can walk. It's for those who are non-ambulatory. 21. When performing active range of motion exercises for a resident, the nurse aide should A. Move the joints until the resident feels pain. B. Keep the body exposed to prevent overheating. C. Have the client do as much as she can. Or D. Minimize proper body mechanics. And the key term is active range of motion. What does that mean? All right, give you about 5 seconds. Revealing the answer in 3, 2, and if it's active, that means the patient can do it on his or her own. So you're going to encourage them to do as much as they can. I have an image here of somebody who has a contracture because this is what happens when patients don't move it. If they are not active, if you don't perform range of motion on their joints can become stiff or stuck. And so whenever you see a fixed joint, we call that a contracture. So range of motion will help decrease contractures. 22. Using a broad base of support means which of the following? Is it A, keeping the feet comfortably apart? B, keeping knees locked in place? C, holding objects away from the body? Or D, holding feet and hands as far from the body as possible? I know you're going to get this right. And we have 13 more to go. If you have stayed for this long and you've not subscribed to our channel, help a nurse out. I think we're like 1,800 subscribers away from having 1 million subscribers. We can do it with your help. I anticipate that we're going to get that. We're going to meet that benchmark this weekend. So we usually get a few hundred subscribers per day. And so preferably by Monday morning, we will have 1 million subscribers. How awesome is that? If you agree that that's awesome, after you put your answer in the chat, go ahead and give us a thumbs up or put a 1 in the chat also. So yes, the answer to 22 is A. So a broad base of support improves balance and stability during movements and lifts. So you want to just spread your legs. They're going to be comfortable. If you have your legs too far out or too close together, when you pick a patient up, you can fall back. So widen your stance, and that's going to help improve your balance and stability. 23. If a client is in traction, the nurse aide should not. Is it A, give a complete bed bath? B, monitor affected skin color? C, change the position of the weights? Or D, monitor all possible distal pulses? Oh, that means you have to know what traction means. Go look it up real fast. Just joking. You don't have enough time. All right. So what does it mean when the patient's in traction? That's right. They've probably had an orthopedic surgery. Do you not give baths to people who've had an orthopedic surgery? Absolutely, we give them a bath. So it's not A. If someone's had a surgery, do you not want to monitor their skin color? Yes, it's going to tell if they're having circulation issues. If they had surgery, do you want to be feeling the distal pulses? Like if they had a hip surgery, do you want to know if they have a pulse on their foot? Yes, you do. So what you would not do is see. Don't change those weights. And so this is an image of a patient who's had an orthopedic surgery. They usually have the overbed trapeze, so that's going to help them pull up. Yes, you can give them a bath. You can put a bedpan beneath them, usually the smaller, the fracture bedpan. But what you can't do is you cannot adjust those weights. So traction weights must not be adjusted as they are set to maintain alignment and healing. Question 24. When the nurse aide is moving the client up in bed, where does the pillow go? Does it go on the chair and out of the way, which is what A said? Would it be B, at the foot of the bed and out of the way? Is it C, anywhere the client wants it to go? Or is it D, at the head of the bed to protect the head? And you know how we do it. It's like 1, 2, 3, and up you go in the bed. And if you don't have a pillow at the head of the bed, guess what? Ouch. So you're going to put that pillow towards the head of the bed near the headrest. So the pillow protects the client head and ensures comfort during repositioning. So just move the pillow up as high as you can. So when you shift the patient up in the bed, whenever you lower them, their head will be comfortable. Question 25. Dangling a client's legs over the side of the bed is done too. Is it A, make sure she is able to sit up first? B, to give her time to put on her shoes? C, to prevent decubitus ulcers? Or D, to prevent orthostatic hypotension? Ooh, I love these big words. Why do we have a patient sit up and dangle their legs at the side of the bed? What do you think, team? Revealing the answer in 3, 2, and it is D. We have to give their pressures time to stabilize. So whenever you get someone upright, you just don't have them stand up immediately. You're going to have them sit. All right. And then you can be putting their shoes on while they're sitting on the side of the bed. Ask them how they're feeling. If they say anything about dizziness, they don't feel good, you put them back in the bed. So dangling allows the body to adjust. It gives it time to adjust, especially those pressures, and prevents dizziness or fainting due to sudden positional changes. So orthostatic hypotension is when the blood pressure drops with position changes. Question 26. Walking a client is safest if done with A. Is it A, transfer belt? B, wheelchair a few steps behind him? C, Hoyer lift? Or D, nurse or doctor ready for emergencies? The safest way to walk a resident. That's right. It's going to be A. You're going to use that transfer belt. A transfer belt is also referred to as a gait belt. Remember, when you're putting a gait belt on, it needs to be snug, but not so snug to where at least 2 fingers cannot fit in. So a transfer belt provides support and stability during ambulation. And yes, we have a skills video that shows you how to use a transfer belt. Again, you can go to fltraining.com, which is shown on the screen, and then go to the menu, which is in the upper right corner, 3 lines. Click on our clinical skills videos, which I think are under resources. Or you can just go to our YouTube channel, go to our playlist, and look for our clinical skills videos there. Question 27. When having a client sit up and dangle his legs before walking, the nurse aide should observe for all of the following except what? Would it be cheerfulness, sudden paleness, excessive sweating, or increased respirations? All right, so we talked about the importance of sitting them up, but what are you watching for? And this one says all of the following except, so it wants you to give me the wrong answer. That's right. Cheerfulness has nothing to do with this. So the answer, the incorrect choice would be A, cheerfulness. So physical symptoms such as paleness, sweating, or altered breathing are signs of distress. They are not emotional states. And so whenever you're getting someone out of bed, you want to be looking for those signs of distress. Again, if you notice any of that, you do not proceed with the procedure, the walking. You're going to get them back in bed. Don't leave them. Go ahead and call your nurse. And if you have access to blood pressure equipment, etc., get the vital signs while you're waiting for the nurse to enter the room. Question 28. When the nurse aide is transferring a client from the bed to the wheelchair, she should always, is it A, unlock the brakes on the wheelchair? B, lock the brakes on the wheelchair first? C, use a Hoyer lift? Or D, put socks on the client first? Revealing the answer in 3, 2, and that's right. It's B, lock those brakes. So locking the brakes ensures the wheelchair does not move during the transfer. Thus, it prevents accidents. Question 29. Before any transfer, the nurse aide should do all of the following except A, check the activity order. B, know the proper procedure. C, use a transfer belt if needed. D, check with the client's physician. Oh, this is hard. So one of these is the incorrect response. Which one is it? Hmm. All right. My babies, my nurse aides, you don't check with the doctor, you check with the nurse. So it's D, that's incorrect. Nurse aides work under the direction of nurses and do not need to consult physicians for routine transfers. You notify me, and if there's something I can't handle, I will notify the physician. So that's your chain of command. Question 30. The pulse located in the wrist is called what? Would it be A, the carotid pulse, B, the apical pulse, C, the femoral pulse, or D, the radial pulse? And I'm so happy I'm finally online. I get to hang out with my babies. I miss you all so much. And so many of you are doing great and wonderful things. So, next stop, nursing school. I know you can do it. Pass your CNA. If you don't want to be a nurse, fine. Speech therapist, occupational therapist, radiology tech. As long as you're doing something in the medical field, I know you're going to do well. All right, so question 30, the answer is D, radial pulse. So, the radial pulse is in the wrist. That's how I have to remember it. Radial wrist. So the radial pulse is located on the thumb side of the wrist and is commonly used for measuring pulse rates. Question 31. A patient is scheduled for an ECG. This stands for, is it A, electroencephalogram, B, electrocardiogram, C, electroconvulsive therapy, or D, electromyogram? It's a little late in the evening for me to be pronouncing these big words. Look, I'm Southern. I'm from the South. And I know some of our students speak 3 and 4 languages, and I'm struggling with the one English language. So I love you. God bless you. But so question 31, ECG stands for electrocardiogram. And I know it's like Eunice, EKG. Well, you know, United States, we have to be different. In every other state, it is ECG. There is no K in electrocardiogram, but in the United States, we call it an EKG. So, whatever. So, an ECG is an electrocardiogram and it records the electrical activity of the heart. But again, in the United States, we also refer to it as an EKG. Oh, this one's long. Question 32. Which of the following sets of vital signs should be reported immediately? A says the temperature is 98.2, the pulse is 122, the respiration rate is 20, and the blood pressure is 84/40. B says the temperature is 99, the pulse is 76, the respiratory rate is 16, and the blood pressure is 134/82. C says the temperature is 98.8, the pulse is 66, the respiratory rate is 14, and the blood pressure is 100/62. And then finally, D says that the temperature is 98.6, the pulse is 90, the respiratory rate is 18, and the blood pressure is 120/70. So which of these would be reported immediately? Fingers crossed. I know you can give me the right answer. You can give it. And if you chose A, that's right. You all, that heart rate's too high. So remember, the pulse or the heart rate for an adult should be between 100 and should be between 60 and 100. And so that pulse rate is 122. And then look at that blood pressure, you all. So I want you to write it down. What's the range for the systolic blood pressure? What's the range for the diastolic? So 84/40 tells me that both readings are low. Depending on what textbook you're using, the systolic blood pressure is anywhere from 100 up to 140 or 100 to 130. So go by what your instructor says. But either way, this one, the systolic is 84. That's much lower than normal. And then your diastolic is between 60 to 80. This one, the diastolic is 40. So that indicates that the patient, as far as the blood pressure is concerned, has hypotension, low blood pressure. And then as far as that heart rate's concerned, that's tachycardia. The heart rate's going so fast, there's not a lot of cardiac output. And so those are concerning. You're going to notify your nurse, but you're not going to leave your patient's room. You're going to call the nurse right there while you're in the room, because if this patient stands up with a blood pressure of 84/40 and a heart rate of 122, if they stand up, what's going to happen? That's right, they're going to get dizzy. So stay in that room with them until the nurse gets there. Question 33. A piece of linen that is placed beneath the client from shoulders to thighs is called, is it A, an underpad, B, a spread, C, a draw sheet, or D, a sheet? So not every facility has these. This may be an older term, just depends on where you work. Some facilities do not allow you to put additional pads beneath your patients because it doesn't allow the air to travel from the mattress to the patient because of all these different layers. And it can also cause additional pressure points or sores because of the wrinkles. And so if you've never heard of a draw sheet, C, it's probably because your facility doesn't allow them. So a draw sheet is used to assist with repositioning the client and preventing friction during movement. And so if your facility doesn't allow you to keep a draw sheet on the bed, you would just use one to help transfer the patient, to move the patient up. But then you'd have to turn your patient to get them off the draw sheet and remove it. Because again, if you have more than 3 layers beneath your patient, some of those aerated mattresses, especially for patients with bed sores, the aeration won't work as well. Question 34. Which bed making procedure is used when the client remains in the bed? Is it A, occupied bed making procedure, B, unoccupied bed making procedure, C, circle bed making procedure, or D, procedure using only fitted sheets? Yeah, can't trick you all. It is A. Occupied bed making is done when a client remains in the bed, ensuring safety and comfort. And of course, we have that video on our channel also. So hopefully you'll look at our clinical skills playlist and you will learn how to do these skills. Question 35. Which complication may happen if a post-op client does not take in adequate fluids? Is it A, foot drop? Is it B, blood clots? Is it C, infection? Or D, diarrhea? This one's hard. So they don't have enough fluids. There's a term for that. It starts with a D. So, and it's not diarrhea. If a patient doesn't drink enough fluids, they're going to become dehydrated. And so if they're dehydrated, the blood doesn't have enough fluid to circulate. The blood gets thick. And what happens with thick blood, you all? It clots. So yes, it is B, it's blood clots. So dehydration can increase the risk of blood clots due to reduced circulation and thicker blood. So push those fluids and ask your patients to move, all right, to get up and walk. And if they can't walk, ask them to pump their feet like gas pedals. That's going to help keep that blood flowing. And if your facility requires that your patient has on the sequential compression devices, those SCDs, put them on your patient. Guess what, team? Great job. I am so proud of you. And thank you all for staying this long. Don't forget to like the video, to share, and to help us reach our goal. Look, if your school, if your buddies, if they are all watching our videos and they haven't subscribed to help us reach our goal of having 1 million subscribers, We don't operate like that. It's called reciprocity. I'm giving to you, you give to me. Just hit that button. That's all it takes, and you'll be notified whenever we post a new video. And thank you for watching. I know so many of y'all want to know when our next video is going to be. Right now, I'm just barely getting these videos out. Hopefully next month's going to be better. And next month, I have a huge surprise for you all. So this month, I didn't tell you, this month makes 26 years that I've been a nurse. This month makes 17 years that we've been in business training CNAs. So how wonderful is that? And this month's going to be the month, August, that we get 1 million subscribers. So thank you all for watching our videos. We appreciate you all, and I will see you in the next video. Bye, my babies. I love you. Have a blessed week and good luck on your test. Bye.